AI, artificial intelligence, is reshaping the way doctors diagnose, treat, and monitor patients. ABC 7's medical contributor, Dr. Ogechika Alozie with Sunset West Health is here to talk about AI in healthcare. You know, we've heard a lot about ChatGPT,
Yeah, absolutely.
which is one of the AI applications, but what is it specifically?
Well, you know, in a former life, this is really my wheelhouse, right, in terms of health information technology. So in the technical terms, ChatGPT is something called a large language model, or an LLM. People ask me and I say, it's kind of like Google on steroids, but it's not really Google on steroids. I think one of the things to note is it literally takes any sentence structure, both written and now some verbal, that you can put in, and it will give you real human-like responses. What's amazing about it is that it got to 1 million users in a week. Things like Snapchat and Instagram and Facebook took months and even years to get to 1 million users. So a lot of people are using this.
All right, so talk about why ChatGPT matters to healthcare.
A couple of things. So if you look at this graph, there's some pros and some cons. I'll actually start with the cons. Privacy is going to be huge. There are no safeguards around it, right? And so anybody is putting anything into it. We have to figure that out. There's no regulation, and we have no idea how the algorithm is making its decisions. And so there's a lot of sexism, racism, classism that can come into it. There are things called moral hazards and the fast pace. But as a physician, for me, it's exciting because there's a lot of things I do as a physician that are paperwork, that are things I don't want to do. They take away from the time that I can talk to patients and engage with patients and improve their care. And if we go to the next slide, we can actually look at some of those examples. I do a lot of paperwork called prior authorizations. This tool is already starting to speed that up at a 99% effectiveness rate.
Wow.
That's amazing. There's something called Health AI and Glass Health that actually is able to put together practice plans. That's also exciting. Not necessarily for me, but for learners in the healthcare space. Medical research is definitely going to change, and patient monitoring is also going to be affected.
All right, I guess the big question, though, is will digital health technology put you out of a job?
So I feel like I'm on the back end of my career, having been doing this for well over 20 years. But if you look at this graph, it talks about things that are repetitive and things that are creative, things that are data-driven and things that are interaction-driven. Specialties like dermatology and radiology, this will affect them, right? Where a computer can see patterns and start to make diagnosis, that'll affect them. Thankfully, I'm over to the right. I look at where I am in infectology or infectious diseases. I'm a lot more interactive and creative, but not even as interactive as psychiatry. So it really depends. This won't affect me today. It will affect physicians over the next decade. And if you have kids that are interested in healthcare, this is definitely going to change the way they learn.
All right, so bottom line, what's the use of AI in healthcare?
I think the biggest thing today is that those that are using it are going to find some of the tasks that they hate become easier and simplified, which gives them more time to actually give patient care.
So in conclusion, I won't have to worry about seeing a robot Dr. Alozie.
You may not see a robot Dr. Alozie, but in the next year or so, you may have an avatar on my website that will answer some of your questions instead of calling. But the bottom line is this: AI, ChatGPT, Bing, Bard, none of those things are going to replace physicians. It will help physicians that use it be more efficient and more effective, and I think that's exciting.
ABC 7 medical contributor Dr. Ogechika Alozie in the flesh. Thank you so much.
No avatar.
No avatar.
Thank you very much.
Thank you, sir.